Welcome back to Behind Our Door. Hi, Julie.
Hello, Nancy.
That we're back again today. Really interesting stuff. Can't wait to get started. We have, we're continuing with our series on alternative therapy for mental health issues and otherwise, just alternative therapy, and learned so much already. And today, just been so much wanting to learn about ketamine therapy. That's today, which we're really excited about. And we are welcoming two fabulous guests that work together. Candace Curzon and Austin Francom. Candace is a licensed social worker, and Austin is a board certified family nurse practitioner, both working for therapeutic alternatives. So we are really grateful that you're both here. Welcome to both of you, and we just are so thrilled that you will inform us about ketamine therapy.
Yeah,
Thank you.
welcome, you guys. Thanks for being here. So I guess I'll start out by asking some questions. Like ketamine in my day was so controversial, right? Because everybody thinks psychedelic drugs, and I don't know. When I think of psychedelics, I think of mushrooms, not ketamine. But when I think of ketamine, I think of horse tranquilizer, and I'm sure none of that is correct. So let's start out by saying somebody who has Googled the word or whatever, um, what would you tell them about ketamine to make it feel safe?
Yeah, so I mean, actually, for starters, you are accurate. Ketamine is used a lot in veterinary medicine because it's worldwide. It's a very valuable anesthetic drug. So it's kind of developed in the '60s as kind of a battlefield anesthetic for in Vietnam. Uh, and then because it's very safe. It doesn't need you don't need an anesthesiologist to manage an airway. It's used a lot for veterinary medicine and actually for pediatrics for kids. So just to give you an
Interesting.
idea of how safe it is, we don't use it for anesthesia. We use much lower doses. We use it for mental health, obviously, and the reason we use it in lower doses is because we do want to induce somewhat of a psychedelic state. Much like you've heard of with mushrooms, it can put you in kind of an open state of awe, wonder, sometimes just a safe space to kind of examine your trauma, your anxiety, your depression. But yeah, that isn't completely inaccurate. It is definitely used for veterinary medicine, not because it's dangerous in any way, but because it's safe, actually. So
So,
that
so how
answers that.
let's go back into, how long has it been around? How long has it been? I mean, when you started using it for thinking of using it for people, for um, recreational, for altering the mind, so to speak, in
Mhm.
a positive way. When did that all sort of come about?
So that's for the history of the drug. So in the '60s, with veterans, it was used as a battlefield anesthetic, right? Because same reason, you don't need an anesthesiologist there to administer pain medicine. And as they kind of found with use of it, it does induce a psychedelic state. And there's always going to be an appeal, just to people in our society for, altering consciousness, looking at things through a different lens of consciousness. And so I think it was kind of discovered through that means. And my facts may be jumbled a little bit, but what they did find anecdotally with veterans that had used ketamine, that it actually helped with some of their PTSD symptoms. And then, obviously, because of the psychedelic properties, it has some recreational use. In the '90s, it has a bit of a reputation as a club drug. Although the effects are much different, the way we do it versus snuffulating or snorting. We do a controlled dose that's either intramuscular or intravenous. That's monitored and controlled. So in order to make the environment as safe as possible. But that's a little bit of the history. It managed to, when Nixon kind of developed the schedule system in 1970, ketamine avoided becoming an illegal drug like some of the classical um, psychedelics we're used to, mainly because of its value as an anesthetic, and it's used worldwide as an anesthetic drug. This is what we use it for is an off-label use for mental health.
It's actually listed as one of the, I don't know, in the top 10 or 5 essential medicines in the world. So that's why it's never made Schedule 1, because there's such high value in it as an anesthetic. And so it's always been legal. It's always been available to us. And that is why the research on ketamine never went away like it did with the traditional psychedelics, which they had done research on LSD, psilocybin, the traditional ones back in the 50s and the 60s.
Mm-hmm.
But then that was taken away. The research was, am I speaking wrong?
No, you're correct.
Okay.
Yeah.
So that was made Schedule 1 because of what happened in the 60s with the counterculture and Nixon. Ketamine was never taken off that. So we were always able to use that. And it just developed over the years where they would see more and more the uses beyond anesthetic for it. And I would say probably closer, because it was never taken off. In the 90s, more and more research was done in regards to using it. It was all along used as it, but in the 90s, there was a lot more research done in using it for mental health issues. Really, in the last 10 years, it's become a lot more accessible and recognized for its use for mental health.
So respected in a different way, like really starting to come up in the ranks. Is this worldwide? Do other countries respect ketamine the same way as in the past? Like you're saying, 10 years, it's gained some notoriety in that way?
Yeah, I mean, I don't know worldwide. I know culturally here, I think the stigma's kind of melted away as other psychedelic drugs have become more in the kind of the social consciousness. I think things here culturally really stopped with Nixon. Nixon and his war with the counterculture, and ketamine kind of slipped through. But I think you're seeing an emergence of some of those classical psychedelic drugs being reconsidered for mental health, and
Yeah,
especially
you certainly
when,
hear it.
yeah, for sure. And I'm a big proponent of our more mainstream drugs for mental health, but I think we've seen, over the past 30 years that it's not that I would say like our kind of mainstream antidepressants are kind of a hammer and not every problem's a nail. Approximately 30-40% of people respond well to an SSRI or an SNRI usually, and then it usually takes a cocktail. Sometimes there's side effects. So it's just a different approach that really hasn't been brought to the light, I would say, until recently. And a lot of my career wasn't even considered. And I, didn't start to hear about it until me and Candace started doing this. So it's not something I've always, we had our awareness of it as far as how it could help our patients as well.
So I have a question. I've read before that ketamine therapy is used oftentimes when the traditional medications are ineffective, or it's just someone struggling with that 3 months to take effect kind of ordeal, which can be an ordeal in crisis. Do you screen when somebody's coming in the first time? Let's, think about that. They come through your doors or they call or what have you. Do you screen before you take someone on for this therapy to say, have you tried all this? Or if someone's interested in just saying, I want to try ketamine first, is that something that can be done?
That's a good question. We have kind of a two-part screening. We have a coordinator, our initial point of contact. She'll do a preliminary screening, just so they understand what they're, what exactly what this drug can do, and if it feels right to them. And then before a patient, before we administer any ketamine to them, I'll do a small physical and mental health evaluation, as well as Candace will see them prior to administering any medicine. So that's the screening process we use. And I think most clinics use a similar, a similar kind of approach, I believe.
Right.
A lot of times when people come to us, they have tried a lot of different things.
Mm-hmm.
I think the opinions about it have changed over the years since we've been working with it. I used to work in a psychiatric hospital, and that was about 10 years ago. And I was there for 3 years, and I would see that the doctors were not using this as often. They were a little bit of, I don't want to say afraid of it, but they were a little bit afraid of it. It wasn't as out there, and there was a lot of thought of you need to try. It has to be treatment resistant depression, and you need to try all these things before. I've seen the attitudes change, and the attitude with us has changed also, where most people who are coming to us have done a bunch of different things before they get to us. Not always though. Sometimes they come to us. We don't require it. Um, I think each clinic is a little bit different. We're all kind of trying to figure this out as we go along. It is pretty new. Um, but the idea that maybe 10 years ago is that treatment resistant depression only, and you have to have tried multiple. The way I kind of look at it now, I think the way is the view is changing, is that we have this tool. It's a very effective tool. Research shows 70% of people are helped by it. Why make somebody go through months and months of something else, and then that doesn't work, we give them something else, and then that doesn't work, and then we finally get to this. So I think is that fair to say?
Yeah,
I don't want to speak out of turn on the medical part.
When we started 5 years ago, and I had this belief too. I felt like a person's depression had to be treatment resistant in respect of multiple medication failures, therapy failure, and then even up to date at that time was saying try ECT, electroconvulsive therapy before ketamine. And as we've worked with, we've really softened our opinions on that. The risks here versus say something like ECT. Where you're not affecting permanent changes in people's cognition. It's giving them more of a lens to kind of look at some of their stuff and maybe a roadmap to healing. We've really softened our approach, but we still, treatment resistant depression is a good criteria, but there's no absolute deal breakers. It's we like to kind of we don't like to approach it as it's certainly not a cure-all, a panacea. It's more of a tool, just like any of those other medications. And we don't, we definitely have a much more nuanced approach than we did 5 years ago. But
It's a lot less invasive than like ECT. To give this a try before you do that is a lot less invasive. I've seen ECT done. I know. I mean, I've seen it work. But it's a lot more invasive. This is not as invasive. And generally, what we're going to see on this, the worst thing that's going to happen is it maybe doesn't work, but it doesn't do anything to long-term memory. It doesn't. It's in and out. You got about 2 hours from start to finish, and so we've definitely changed our opinion and approach to it.
And how many times, like a week, or how many times do you have to have this 2 hour or whatever is it an infusion you're saying?
it can be an intramuscular injection, which is just a shot in the arm, or it's an infusion that I'll infuse over about 15, 20 minutes, sometimes longer if the patient's really wants a slow induction. The study we use recommends twice a week for a series of 6. we found that's nice for a study, but in reality, most people can't do twice a week because they have jobs and lives. So we try to encourage them to at least do, we try to encourage them at least to do once a week. We recommend a series of 6, but not because we feel like 6 is a magic number. It's just we need a drug holiday to kind of see what we get out of the treatment. So it's like you need a stopping point and really evaluate how this has helped or hasn't helped. And we if somebody feels like it's not helping, obviously we're not gonna, there's other things besides this, so we don't want to push. There's no, like I said, we're not. It's just a medicine. It's just a tool. So we want to make sure that if it's not helping, that we look at other options, like even sometimes even non-pharmacologic options like therapy, self-care, stuff like that. But obviously, we do this for a living, and we've seen it help. So we're pretty confident in some of the benefits of it. But
And what type of mental health issues do you think are a good candidate for this?
our top 3 are usually depression, anxiety, and PTSD, and that's the top 3 mental health problems we see. Sometimes we'll get like a normal lifespan type of existential stuff, like death of a loved one, or a child, or a spouse, a parent, moving through changes, life changes, maybe your kids, that existential, what we I guess we'd call a midlife crisis. Kids are leaving the nest, figuring out what what to do next. And then we also have a big component of people going through like faith crisis, or faith transitions, stuff like that. At least here in this state we do.
Okay. So
So
not for people who suffer from bipolar or borderline or schizophrenia or...
good. That's a good question. Do you want me to?
Well, okay, so one of the criteria that we wouldn't give somebody ketamine is if would be schizophrenia. If they're actively psychotic or actively manic, so that would be the bipolar. Being bipolar, actually, the studies show that it is really effective for bipolar as long as they're not actively manic.
Okay.
So it can, with the symptoms of bipolar, if they're actively manic, we would not give it to them. That could actually make the mania worse. Actively psychotic, no. Schizophrenia, I wouldn't say.
Yeah, any psychotic disorder, because we are kind of, at least for that moment, we're unmooring them from reality for an hour. Anyone that has any history of psychosis, we approach it very carefully. Now there are other things that could make you psychotic. I mean, amphetamine use a lot of times can use psychosis. So we would want to carefully screen that, make sure that they're not schizophrenic or schizoaffective or bipolar with psychotic features.
Right.
Because we don't want to exacerbate that problem. But usually those types of patients are pretty chronic. That's why I see them before we can usually assess them, look through their psych history, their medications, and if we feel like obviously our first and foremost thing is the patient safety, and we would probably recommend them to more traditional type of treatment. But that's we both have a lot of experience in acute psych, and so we kind of have to rely on our judgment there.
Oh, sorry. Borderline personality disorder. We've actually had pretty good success with that. We have quite a few patients.
Oh, that's interesting.
Yeah. Studies have been mixed on that. There have been some studies saying it's not effective. What we've seen anecdotally is it's been very helpful for some people. There's some more studies coming out now saying that it's helpful. I think it's very helpful for the symptoms of BPD. The biggest thing really when we're talking to anybody who's coming in would be to assess whether they have the skills to handle what's going to come up. And so that's going to be case by case. Somebody with borderline personality, one person may have the skills to handle and somebody else may not. We really try and assess the individual. But anybody coming in, we're just trying to see, do they have support? Do they have skills? Do they have it? Because what I really consider, I think of ketamine as a very safe container to go in and do your work. It's going to bring stuff up. It's going to shake things up a little bit. And it may be difficult. It can be a really beautiful experience. And it can also be a very difficult experience. And it does go in, and if nothing else, it goes in and starts to shake things up. So we really want to assess each individual. And I'd be more probably do that a little bit more with somebody who has diagnosed BPD, just to make sure that they have the ability, the support, and the ability,
Yeah.
and the skills.
Yeah, we also want to make sure they have the support around them, and that can be like, do they have a therapist that they can kind of bring this stuff to? Do they have good social support, supportive spouse or family? Substance abuse, with borderline personality, there's a lot of substance abuse, a comorbid condition. So there's a lot of things there that kind of, can kind of clue us in on how successful it will be or not. But so there's variables there that we feel like can optimize success if they don't have those things in place. That's one thing we'll try to accommodate them to get into therapy and get support. And and there is some other things. There's some evidence to suggest it helps reduce relapse rate from people in sobriety.
I was going to ask that, if this is for people with addiction, with issues of addiction.
Yeah.
It can. The stats are good for, stats are pretty good for like alcohol, benzos. Stats aren't great for opiates for preventing relapse, but that's opiates are tough that way. So it can be preventative. Depends on people's philosophy on sobriety. Sometimes you'll get a 12-step tradition that's very, very strict on no alternative substances. And but my thoughts are, for some substances, it can help people maintain sobriety and not turn to substances that are destructive for their lives. So it can be helpful for addiction as well.
So that's interesting.
So picturing somebody walking into their first ketamine therapy session, if that's what you would call it, if you could just sort of take us through what that would be like on a time scale, in a way of, do they feel the effects right away while they're having the therapy? Is it when they go home? Is it, how long does it last? This sort of, I've never done ketamine, so I don't know.
Yeah. Are you doing therapy while you're getting the drug put in you?
Are you talking to them? Exactly.
That's a good question. So after we do our assessments and they're ready to go, we have someone give them what we call flight instructions, just kind of like, okay, you're going to be in an altered state. Here's some good coping skills to be able to manage that. But we look at this type of an experience as an immersive experience, meaning we're trying to put you in a state of where you almost you do feel like you're out of your body. We do our initial dosing based on their weight. And so we try to stay in a dosing range that's been studied by MAPS. And
MAPS is the Multidisciplinary Association for Psychedelic Studies.
So that's roughly between 0.5 milligram per kilogram and 1 milligram per kilogram. And then while they're in that state, sometimes it's difficult to communicate, but we check on them. And if they need support while they're in that state, we can help ground them, usually just mindfulness type of stuff, breathing techniques, hand holding, stuff that kind of helps them feel grounded. And then when they start to come out of it can be a very, the best way to describe it, it's an ineffable experience. And we just kind of encourage them to talk about it. It's just so they can kind of put some constructs around a very weird experience. But in the way we do this type of experience, we're not actually doing therapy. we're just trying to help guide them through this experience, and hopefully whatever comes up, they'll take to their therapist, to take that energy and work through it in therapy. So.
We have we have two groups, Zoom classes. One, and we do this every week. One's a preparation group where we have our life coach, who's very familiar with ketamine and has done work with ketamine. She'll help them, and she's also trauma informed. She helps them come up with their intentions and really talks about like playlists and prep and how to, all the things. Don't eat before you come in, and really preps them for it.
So you listen to music while you're doing this?
Usually.
Yeah.
It's music of your choice, or
music of your choice. We have lots of playlists that we'll recommend, and there's lots of playlists that we received when we did some training at the Ketamine Training Center that are curated for this, that help you really flow, help you stay grounded, help you just flow with whatever's happening. So we offer preparation group each week, along with the initial assessment with our intake person. She's amazing, and she'll like really prepare them for them. And then we have this extra group that you can sign in for on Zoom each week for intention setting and any other questions you may have.
And we offer that just to kind of complete the loop so we can check in, they can have connection to other people going through similar stuff.
That's great.
Just kind of make sure that we're not just giving them ketamine and throwing them out there in space. But some people need that, some people don't, but we like to make sure they know they have support available if they need it. But we also encourage individual therapy outside of us, and good self-care. That's mindfulness practice, good diet, good exercise, all the stuff that will support this working better.
Also, it's interesting that you said before coming in, they have to have fasted for how many hours before?
4 hours.
4 hours?
Mm-hmm.
Yeah. Nausea is a common side effect.
I was just going to ask that. Does it make people get sick? Yeah. Oh, gosh.
We don't put it in there just in case. I can give medication that will help, but just some people just get really sick. Like it's almost like you're just genetically wired to get sick on this med. So just hit or miss that way.
And can you take medication? Can you be on medication, like, prescribed medication from your therapist or psychiatrist or doctor?
Yeah, absolutely. We would never recommend somebody going off their psych meds to do this. That's
okay.
Again, that's a complicated thing, and they need to work with their medical provider. We look at this as adjunct therapy. If you're seeing a psychiatrist, this is something adjunct to what you're doing with your psychiatrist. If the right thing for you to do is to go off your more conventional medication, that's really between you and your psychiatrist. And for us, this is for that. We don't backseat drive, nor would ever backseat drive what a patient's doing with their psychiatrist. But we also, we don't look at this as conflicting, as something doing adjunct with the work they're trying to do. But I don't know if I answered your question well. Some psychiatric meds will dampen the effects of ketamine. We can always adjust, and that's part of my assessment. Is we can always adjust the dosing based on the meds they're taking. A little bit of it's predicting, how they'll respond, but most psychiatric meds will dampen the effects of ketamine a little bit.
Oh, that's interesting.
Yeah.
So what about the cost? I'm assuming this has yet to be covered by insurance. Am I correct in that?
It's still considered off-label use the way we're doing it. So we have not had much success. There have been a couple of people who fought with their insurance companies and will provide super bills, but as of now, it's not covered for the way we are using it. There is a spray, Spravato, that is covered, that has actually been authorized for use for depression. I mean, that's not how we're doing it. And so it is this is pretty average on most of the clinics. I mean, they range anywhere from $300 to $500 per session. Ours is $349. We do offer a package where if you buy a package of 6, you're basically paying for 5. We're trying to give you a price break there. So I think it's $17.45 that you're paying for a package of 6.
And that's
We
also a recommended like amount of generally 6 rounds of this is a good way to start seeing how
It's
this.
not a magic number, but it is a really great number for us to see some changes.
Mhm.
And if we don't see changes in 6, we're not going to tell you to throw good money after bad.
Okay,
People have
interesting.
done more than that. It's not, like I said, it's not a magic number, but we generally do see some changes with the 6 sessions. Yeah. And so that would include the meeting with Austin on the first time, the nurse practitioner, having a medical exam, and that also includes the preparation groups, and also we have integration groups that we offer. So all of that is part of the service, because we really want that wraparound.
And we don't want to like have we don't want these kind of nickel and dime costs. We just want, this is what we offer, this is the price, and this is so that people aren't confused about, well, is it extra for this? It's just, it's kind of a fixed rate. But
also, it's encouraging. I mean, I love the way you set that up, so that people, if they're interested, can go into that group and share, and kind of this probably a new experience for many. And that show, not giving them such an option of it's extra is a great idea.
Yeah. We found it's really helpful. I've been in those groups, and it's really cool because the people are like, hey, I've done this, or I've tried this music. I'm coming in with, this is how I'm changing some things in my life. These are some things I've noticed. And then people start to like, oh yeah, I'm noticing this too. And it's actually really cool to see this.
Well, it's nice to be in a community.
Sorry.
Oh, sorry, I didn't mean to cut you off.
No, that's okay. Go ahead.
Just, when people are depressed and they're looking through life with that lens of depression, they think they're alone. And it's nice to be in a group where it's like, I'm depressed. I say I lost my child, or I lost my husband, and you're in a group with somebody else that's going through something similar, or, that you're not alone when, and to have, the worst thing about depression is that loss of hope or feeling alone. And even though maybe it won't cure your depression in the way you think, but at least it'll give you some hope that, hey, this is a transitory thing, and I'm going to move through it because these other people are doing the same thing, So anyway, sorry about that. And we also do, and we like first responders. So we do offer discount for like law enforcement, firefighters, military, nurses, and therapists. So we love those people. So we want to make sure that, and those people have a lot of trauma and carry it. So we want to make sure that they, if they make
Thank
it affordable.
you for that. I don't know if you guys know that, but I just retired from law enforcement.
Oh,
good.
Yeah.
Well,
people to be able to do their work, who do the work for other people.
It's a hard.
I really genuinely appreciate that.
Yeah.
I wanted to touch on something. I'm not sure if we covered. I think you had asked what the experience is like, or how fast it hits you, or if I can touch on that quickly. I wanted to say once you've had the assessment and you're in there and you're ready to go, we've got therapy rooms. We try and make it less clinical, more comfortable. We've got recliners, we've got couches. You have your own space, and then once you're ready to go. And either way you get it, whether you get intramuscular injection or you get IV, you're going to feel it really fast. Depending on the route of administration, you're going to feel it in about 3 to 6 minutes, depending on how you get it. Intramuscular injection is an injection in your arm, and it's going to be faster. You got about 3 minutes. The deepest part of it is about 30 to 45 minutes, where you're just transported and somewhere.
Wow.
I can't tell you where. I mean, everybody's so different, but it's an out of body. It can be an out of body experience, and it happens really quickly. Even on the IV, where it's a steady drip, you've got about 8 minutes before you feel it. But they've got the biggest, deepest part of it is 30 to 45 minutes. And then you start to come back to yourself, you come back to your body, and then you've got the space for another 2 hours to come back fully and ground, and then that's when we'll come in and talk and chat with you. We're checking in on you every few minutes, but it's so internal. You're really it's very internal. Most people don't want to, especially at the doses we're doing. But when you come out is when we're going to be checking in and hey, what did you see in there? What did you experience? Did you bring anything out? What just really trying to talk about it with them. And then I also wanted to throw out that the way we do it that way, we're not doing therapy. Most people at those doses can't sit there and talk. We're taking your normal way of thinking and talking and offline. We're sending, this medicine is sending you into a different world. But we do offer what's called ketamine assisted psychotherapy. It's CAP for short. And that would be giving somebody a lower dose and a therapist sitting with them the whole time.
Oh,
And
interesting.
that just costs a little bit more because we got the therapist sitting in there the whole time.
Right.
We do a little bit lower dose, either subcutaneous or lower lozenges. And then that allows them to be more open, more available to go into emotion, more ability to access emotion and talk and still have a foot in this world. And a therapist goes in and just does some really deep, concentrated work. And the therapist, me, and then we have one other therapist, will meet with the person before, get to know them a little bit, talk about what it is we're working on. Sometimes they're my own clients that I've known for a while, and then we can just dig right in. But the way we do it, if it's somebody just off the street that we don't know, we're going to meet with them. We're going to assess what it is they're really wanting to dig into. And then we can have some very deep session of therapy that really opens somebody up to be able to access deep emotion. It's crazy. I've been a therapist for 10 years, a little over 10 years. And it's like therapy, I love therapy. I think it's important we need to bring awareness to our stuff. And so I think therapy is important, but therapy with ketamine is like, we get in and we like dig in and just jump in. Whereas with the regular therapy, we can talk and talk and talk. And we're on this thing. Like I believe in it. I've used it. I've seen it work, but it's like, we can be working on something for a couple of years. Whereas with ketamine, it opens you up and it allows you to go in and all the things that all of a sudden, in your heart, you feel it, you feel the difference. It's not just us talking about it. It's like you go in and the things that we were talking about, like all the stuff you learn in therapy, all of a sudden you're like, oh yeah, now I get it. Now I feel that. And that's where I think ketamine is very, really kind of special in regards to like using it in conjunction with therapy. But you don't have to use one of our therapists. If you have a therapist, your therapy is going to change because you're opening yourself up and you're going in and we're stirring and it's stirring things up and really, so doing it with us or with your own therapist, ketamine helps change therapy in a really positive way where you can just like dig in. I've seen people move through things really quickly, like in 1 or 2 sessions rather than 1 or 2 years.
Is that something that you're describing, that someone would have to go through a few sessions of just, regular ketamine, muscular injection or infusion first? Or do you sometimes people say, I just want to dive in for the more expensive therapy, talk therapy, lower dose?
Most people that want to do the ketamine assisted therapy have done some immersive experiences like we described. They've done that, and then they're like, well, I would like to try to utilize this during therapy. And so a lot of them just kind of come to that idea after doing it with us a couple times, and they want to try it with a therapist at a lower dose. And so that's really the 2 different modalities we offer. But most of our clientele probably do the immersive experience, but we have some that want to do the KAP experience as well. So it just depends on, we kind of let them guide where they want to go with it. But it's usually better to have tried it once before because you kind of know what to expect. Yeah.
It's such a strange experience. I mean, there's nothing like it. We can sit here and try and tell you what it's like,
right,
but we don't have words for it.
I'm gathering that.
Yeah.
I'm trying to imagine.
It's super intriguing though.
Yeah. I just cannot picture.
Yeah, we really can't. So I always feel a little more comfortable if someone's coming in to do CAP, if they've already had the ketamine experience.
Okay.
know how they react to it. We know if they're going to get sick. We know, I mean, it's a weird world. We are sending you into one of the craziest experiences of your life. So I always feel a little bit better if I don't know them and they're not one of my patients and they've never done ketamine, to have done a session or two of more of the immersive one. And then we go from there, like, what did this do for you? What would you want to do some more like concentrated, deeper?
Can you bring a
guided?
friend? Are you allowed to bring someone with you?
Yes.
Absolutely.
I never
Oh,
We
knew
like
good.
it to be,
do
we like
people
it to
do
be
that?
client-centered. Yeah, so whatever makes
Oh.
you feel safest and most comfortable. We've even had people bring small pets sometimes, as long as they're they're
Yep.
good pets. But whatever people, whatever, we'll accommodate within reason what makes you feel safest. So yeah.
I'd say
Oh,
bring
that's good to know.
bring somebody in that feels safe to you.
So
Yes.
you recommend that? You think it's a good idea to bring somebody in? I mean,
Everybody's a little different. Some people just want to do it alone, and some people want somebody to kind of just hand holding.
yeah, now that I think of it, Julie and I had a guest, I don't know, about 2 years ago who was really into this. It kind of was the first time I thought, we got to get someone on who really talks about this,
Mm-hmm.
who knows about it. So, as you two, which is great. But she was saying how she said ketamine is amazing and that she brings her sister, I think,
Yeah.
right, Julie?
Yeah.
Did she say she
Yeah.
brought her sister? And I couldn't picture. It's interesting to learn the details.
Yeah.
I think it's nice because really it is a strange experience. It is one medicine that you can take where you might forget. You're like, how did I get here? What did I do? What is going on? It's a medicine where you can forget that you took a medicine. And if you look over and you have somebody there that is like her sister, or somebody that you're like, oh yeah, okay. It can be grounding. It can be really
Ground
helpful,
you. Yeah.
be really supportive, that you're like, because it's weird.
And
What's the age range? What's the youngest and what's the oldest that you would do this?
we preferably adults. We have with parental consent and we have done minors just with parental consent, the patient's consent, and the consent of their med provider and therapist. If everybody's on board, we've done it for minors, but beyond 18, we've done pretty much across the lifespan. We're to some degree, we haven't arrived. We're still evolving and learning as we've changed the way we look at it and the way we do it over the last 5 years. And our hope is we continue to learn and evolve, because we haven't. I feel like there's still a lot of stuff we could improve. So we're kind of learning too. So sometimes we're what we're saying today, we might maybe 5 years from now, if we're allowed to continue to do this, because it's been really great to be able to help people in this way. So as long as we're allowed to continue to do that, I'm sure we'll do it differently 5 years from now. So
Yeah.
Go ahead.
We've been having a lot of guests on with just these new, more, I guess I call them holistic. I don't know if that's the right word, but just new emerging therapies. And I think it's going to change the game of the way we look at mental health in general and how we treat it.
Oh yeah.
For sure. Yeah, that is all changing, and 5 years, 10 years from now, it's going to be different. And to touch back on the minors, we generally this goes back to us assessing whether somebody has the skills to handle what comes up. So that's a case by case basis. We have learned that if parents are pushing, I want to get my kid in, I need this for my kid, I need to fix my kid, we always check in with the kid. Are they mature enough to handle whatever comes up? Do they have the skills? Are they doing this for mom and dad? We always make sure we're talking to them and getting that. We don't do it very often, but we do it particularly with kids who mature. We just look at maturity. Are they there for themselves, not just keeping mom and dad happy? Because a lot of times parents are like, here, we don't know what to do.
Take them and fix them.
Yeah, like saying nothing else is working, so it's not the answer.
We have empathy. Yeah, I mean, a lot of empathy for tried everything and a parent can be desperate, but this is really the we've still had the times to say no, that you need to maybe continue more
this.
conventional.
Yeah. And
before-
especially, depression, I feel like so many of the calls I've gotten over the years of parents that say just nothing, with a minor, nothing seems to be working, but the body's always changing too. It's just, I can see why you would focus on adults more with something
Yeah.
like this.
Yeah.
Yeah.
And
But
so if
we have a really great tool, and so I might differ a little bit here because I'm not the medical person, but we have a really great tool here, and it's just like there's a little bit of thought on my side of like giving them traditional medications and therapies that aren't working, and a kid is suffering. Why wait till they are 18 and have their
Mhm.
their
Agree.
brain
Right.
develop that way when we have this tool? So it really, like, I'm actually quite excited about it in using with minors, with children. But we always just really want to make sure, like, can they handle whatever's going to come up? And so we
Yeah.
just assess it really carefully. So.
Yeah, and I'm not against it. It's just I think there's more, treating it with kid gloves. There's more
Mhm.
boxes to check, and I think everybody has to feel good about it, and especially the patient, even if they're a minor.
Yeah.
I want them to have autonomy in their decisions, and definitely if they're being pushed into it, or we won't do it. We really need them to show up for this because traditional antidepressants, this is definitely a different way of looking at a mental health type of medicine where it will actually push you into your trauma, your depression, where traditional, like say an SSRI, it's going to make some neurochemical changes while you're on that drug and blunt you maybe blunt you a little bit from your depression or anxiety. And so one thing's kind of the philosophy, the way they work is a little different. And you want patients to really feel informed about what we're doing here, and if we don't feel like they really understand what we're doing, we obviously don't want them to. I mean, that's part of consent, right? They need to really understand what.
Yeah, this is a whole different
I
thing.
agree.
Yeah.
And children need to have a voice.
Yeah,
No
absolutely.
matter what the treatment is. I always say ask them because they will tell you.
Yeah.
They will
for
tell
sure.
you. So if people want to find you both, where should they go look?
Our website's the easiest, I think.
Yeah. Our website is ktherapyslc.com.
And you're based out of Salt Lake
We're
City?
in Salt Lake City. We've got 2 locations in Salt Lake City.
Okay.
West Jordan and Salt Lake. Yep. And yeah, the number there will put us in touch with our coordinator, and she does the initial screening. So, her name's Nina. So,
Oh,
yeah.
perfect. Well, gosh, guys, I have learned so much. I mean,
Me too.
this has been amazing. I can't wait to share this information with everybody I know and everybody I've worked with.
Yeah, really. Thank you so much for your valuable time. It's really been interesting.
Yeah, thank you for having us. I really appreciate you getting us out there. Yeah, thank you.
Appreciate it. Yes, thank you, and thanks for being good to us. We appreciate it. So,
thanks, guys.
yep.
Okay.
Bye-bye.
Bye-bye.
All right. Bye, you guys. Thank you so much.